from the station that's on your side. This is Channel 7 News Good Morning Arkansas.
So March, which is just around the corner, is actually Colon Cancer Awareness Month, and colorectal cancer is actually the second leading cause of death in the United States among cancer deaths. So it's one of the most preventable types of cancer, and that's important information you need to know. One of the most treatable types as well. Joining us this morning to help you get motivated to get screened and the importance of that, Baptist Health gastroenterologist Dr. Paul Williams and Baptist Health President and CEO Troy Wells joining us this morning. Gentlemen, welcome to our studio, and thanks for joining us.
Thanks for having us.
Dr. Williams, let's start with this month, March, or the next month that is right around the corner. Why is this so important to have a month dedicated to this type of education awareness for colorectal cancer?
Well, first of all, thank you for having us here. It's just very important to have a month that we acknowledge and make people aware of this deadly disease and how preventable it is. You know, with early screening, early detection, like we said, what goes not only preventable but sometimes curable.
What is the curable rate if caught early? I know it's pretty high up there among cancers, right?
I don't know the exact rate, but it is very high if you catch it early. You cut it out, you remove the cancer, and you're done.
Wow. Okay. Troy, I know this is something you have a personal story to share with us this morning, and why screenings are so important.
Well, I mean, I'm a great example of number one, being really lucky. I was lucky in that I used good sense when I started having symptoms, some odd symptoms, something going on. Wasn't any pain, nothing, you know, horrible, but just something not right. Talked to my family doctor. He said, well, it's time for a colonoscopy. I said, all right, great. I mean, I had a lot of anxiety about it, so I was happy to get to do it. And for me, I was lucky in that the symptoms that caused me to go and have a colonoscopy that got me to do it had nothing to do with what was found ultimately, which was a dangerous polyp that was removed. And I think it all, you know, it hit home for me when Dr. Williams calls and says, you know, I'm going to do you again in a year. And I thought, well, that's, you know, a little more serious than I thought. Usually you go do it once, you're good. You go 3 or 4 years.
Right.
And he said, you want to do it, we got to do it another year. And I thought, well, you know, this was a pretty close call for me. And it rattled me a little bit. And so personally for me, this is a big deal. And I want to tell everybody every chance I get to go get a colonoscopy, get screened, and do what you got to do. Take care of yourself.
One of many stories you probably hear,
yes.
Dr. Williams,
yes.
of, you know, symptoms that happen that you start thinking, you know, this is just a little off, and the importance of talking to your doctor about it, so vital. So go over some of those symptoms with our audience. Tell people what they need to look for that maybe could get them in to get screened or talk to their doctor about it.
Unfortunately, symptoms is a misnomer in this situation. There really are no symptoms of colon cancer. The reason I say that is people can have bleeding, people can have weight loss, people can have abdominal pain. That can be one of 20 or 30 different things that can cause those symptoms. So that's why we say colon cancer really doesn't have a symptom, but we have warning signs. And in Troy's case, he had some warning signs, and he heeded that and came in and got his colonoscopy done. So if you're having abnormal weight loss, if you're having bleeding, if you're having unusual abdominal pain that has no explanation, talk to your doctor about getting screened and getting looked into.
Okay, and whenever it comes to age groups for this, I know there's certain ages that we kind of have a standard for, right? Have those changed any, or what are the ages that people really need to start getting serious about this?
Up until the last year, it was always 50 and above, you need to have a screening colon exam. Starting at the age of 50, you need to have a screening colon exam. We now know that that's actually been back down. It's now 45, so anyone 45 years of age and older needs to have their screening colon exam done.
Okay, what about family history? If someone has a family member who's had this before, does that change it?
That changes it drastically.
Okay.
It's based on age, so if you have a first degree family member, first degree being mother, father, brother, sister, son, or daughter.
Okay.
If you have a first degree relative with colon cancer or bad colon polyp, younger than the age of 60, then you should start your first screening at the age of 40.
Okay.
Or 10 years before the age at which that person had the cancer polyp. So let's say you were 45 and you were found to have a colon cancer, then your children or your first relatives should start at 35.
Okay, so that's important numbers you need to know. And Troy, I know you can't tell people enough, you know, go get screened, go get screened, go get screened.
I've been bugging all my friends.
I'm sure you have, but, you know, as you get an opportunity to talk to the state of Arkansas and our audience this morning, maybe just tell them maybe some of the things that they need to expect going to get screened and how it can really save their life.
Well, first of all, it's a lot easier than what you think. It's really not a big deal. The worst part of it is you got to take a day off work, and most people probably like that.
Right, yeah.
But the prep is easy. The procedure is nothing. It's just, it's not a big deal. And in my head, I had it as a big deal. And for most people, I think that's the case. And it's interesting, as I've read more about all this, I always thought, well, I need to be telling men to get out there and get screened because men are hard-headed and they don't want to do it. Well, it turns out that females are just as likely to not want to do it as males. And so I think for men and women in general, the younger generation, I want to encourage people to do it. It's just not that big a deal. I know it seems like a big thing, but it's really not. It's simple.
And when it comes down to it, life or death.
Can mean life or death.
It can mean life or death, and you want life in that instance. And if it's just taking a day off work and going through a procedure, I'd say it's worth it, folks. So if you'd like to talk to your doctor about getting screened, or if you'd like to talk to any of the folks at Baptist Health about these options available to you, contact the Baptist Health Helpline. You can also go to baptist-health.com for more resources. Anything coming up for the month of March that we need to know about in terms of just awareness? You guys are going to be traveling around. You're going to be talking with more folks about it and trying to just encourage screenings throughout the month.
Listen.
Okay.
That's right. Yeah. Talk to your doctor.
Sir, that's the main thing, is just talk to your doctor. If you have questions, if you have concerns, talk to your doctor, get educated, and then get screened.
And remember, Dr. Williams said, symptoms not really the factor here, warning signs. So know those warning signs and talk to your doctor about them. Gentlemen, thank you again for sharing your story. Thank you so much for all the work that you guys do at Baptist Health.
Thanks for having us.
We'll see you next time.